Welcome back to Live Now from Fox, where we want to turn our attention now to healthcare services for millions of Americans. Taking a look here at a social media post, just a reminder to everyone that time is running out to find your best Medicare coverage for 2026. Experts are saying it's important to compare those plans before the deadline to enroll for that open enrollment of Medicare, that deadline being this Sunday, December 7th. Now, anyone who misses the deadline will likely have to wait a full year before they can make a change to their plan. Joining us now to talk about how important this is the administrator for the Centers for Medicare and Medicaid Services, Dr. Oz. Dr. Oz, good to have you on.
Thank you for having me. You said it beautifully. We've got until Sunday to sign up. You go to Medicare.gov, or if you want to talk to someone, call 1-800-MEDICARE. But this is a beautiful opportunity for you to customize the care that you're going to get for the next year for Medicare. You could probably save yourself a fair amount of money, hundreds, maybe thousands of dollars if you do this. And we've done lots of things to make the system work even better for you. So take advantage of all the things that are out there, especially if you've changed a doctor, or you're on new medications, or you frankly don't remember what you did last year. This open enrollment period is your last time. You got 1 week left to make some choices.
So I'm glad that you mentioned that, some of the changes that have been made. Let's talk a little bit about when you took over this agency here for President Trump's latest term. What are some of the concerns that you heard from millions of the recipients, and what are the specific changes that have been made to address those concerns?
Well, there's two big concerns. The first is, why don't you give me customized information that suits my needs? Why do I have to go search it all myself? And they're right. Most websites you go to now, they'll know who you are. You either use your fingerprint or face recognition on your phone, and it'll quickly adjudicate or tell you, warn you about things that might not be in your best interest based on what the system knows about you. So if you're on Netflix watching a video, it'll tell you what videos you'll probably like and won't like. We want to do the same thing within Medicare. As soon as we know that it's you, we want to give you advice and recommendations about things you probably would want to do if you knew a little more about the program. And so Medicare.gov does that now. Medicare.gov also has a plan finder, which means it'll help figure out, based on the doctor you have and the medications that you're taking, what plans make the most sense for you, which ones will save you money. Which one should you not take because your doctor's not a member, for example? And so all that now is part of the new Medicare.gov experience. We also realize there are some people just don't want to use Medicare.gov. They'd rather talk to somebody, a real live operator. So we've beefed those services up. You call 1-800-MEDICARE. Someone will talk to you. Someone who cares about you will talk to you and give you advice that might be life-changing.
And then, Dr. Oz, I do want to know, I mean, so many changes made already to some of those services when it comes to Medicare. What's on the horizon? What comes next just to up all of that progress?
Well, we're getting better and better at customizing care for you. So what you'll find over the next year or two is, based on the illnesses you have, we'll be able to give you all kinds of recommendations, not just about which doctor, which insurance plan to take, but which doctors you might want to see. What are some ideas on medications and their pricing? We're launching Trump RX, which takes advantage of all the negotiations we've been doing to get drug companies to share prices with Americans that are also being used for Europeans. Right now in America, you pay 3 times more for the exact same drug sold in another country. That's not right. So we're going to equalize those prices out, and all those numbers will be available to you as part of our program. But the big story is this: Medicare is the crown jewel of our social safety net program. It was created 60 years ago. It's a vibrant, healthy program that provides all kinds of life-saving, life-changing services. It's yours. We work hard to give it to you, and one of the ways that you take ownership of it is through the open enrollment period, which ends on Sunday. So before you watch the games on Sunday, you must sign up on Medicare during the open enrollment period on Medicare.gov.
Dr. Mehmet Oz, the administrator for the Centers for Medicare and Medicaid Services. Again, we appreciate your time here. Thank you for all of the information. Open enrollment ending December 7th. You take care.
God bless.
We are going to keep it moving here, bringing us back to that social media post that I showcased right before we had Dr. Oz on. It is from Medicare.gov, so you can see there, time is running out. You have 1 week left to take part in that open enrollment period. And as Dr. Oz was saying, it has been quite simple for anyone who may not be tech savvy or who might not know what to do. I actually do want to show everyone that has tuned into this segment. So I'm going to take us first out here to this wider vantage point that we have in our newsroom, because in the same computer in which I had Dr. Oz pulled up, I do have the homepage for the Medicare services. So take a look at this. Let's bring it up here in full. All you have to do, heading to medicare.gov, and this is what you're going to be seeing when you first open that website. So you see up here, you have open enrollment ending December 7th, find plans. So you can click on that with your mouse. Also get started with Medicare, and then here there's a bunch more tabs showing you how to log in or create an account, find health and drug plans as well, find healthcare providers, also talk to someone, as was mentioned. Then they have several other tabs to go here, again with the open enrollment ending December 7th. Then you have a help to spot and prevent Medicare fraud, which is also top of mind to many people that are trying to enroll, especially online. And then many more services to learn from. You can also get important news and updates. You just enter your email here and it'll take you to that step-by-step process. And at the bottom, just some more helpful links for anyone who is interested. We want to step away for a quick commercial break, but we'll continue to follow many more of the top stories and also live events when we come back.